Today we're going to talk about tooth wear, the different types of tooth wear, its impact on the mouth, treatments, and how we can either prevent it or at least alleviate the damage caused by it. When talking about tooth wear, I kind of break it down into two categories. The first category is it's your fault. The second category is it's probably not your fault. I know it seems kind of basic and it seems kind of black and white. That's how I see it. So the first category of it's your fault. This goes into chewing on ice, or ripping packages open with your front teeth, or chewing on a ballpoint pen, or basically any behavior that you're doing with your teeth that you're not supposed to be doing. You know you're not supposed to be doing it. And typically speaking, that kind of wear and damage is located to one or two teeth, because if it's a habitual thing, you're always chewing on the right thing. Or if you're biting off a package, you're just addressing those front teeth. The best way to address that is obviously change your behaviors. And if you can't change your behaviors, you need to be at least aware that those habits are going to lead to problems with your teeth down the road. Things like chewing ice and really hard things that you probably shouldn't chew, whether that's frozen milk duds, chicken bones, you name it, we've seen it. All those things, the teeth are not designed to handle. And if you put enough force and something hard enough between the teeth, unfortunately those teeth are going to break. And at that point, when we see errors caused by intentional habits, a lot of times it results in damaged teeth that need to be replaced, whether that means with a crown, or unfortunately if the fracture is more intense, extraction, an implant or bridge or other future dental work down the road. So my advice would be, if you want to protect your teeth, try and avoid any kind of destructive dental habits that lead to wear. Let's talk about the other category, the unintentional. Whether this is minimal, like toothbrush from using a medium or hard bristle toothbrush that can cause wear on the outside and the inside surfaces of the teeth, or whether something more involved like bruxism or grinding where you're really wearing down the teeth, there are lots of different ways that can cause wear and tear on the teeth. The first category that we look at for dental wear is going to be diet. So diet is really important, whether it's you eat a lot of acidic foods, whether you drink a lot of carbonated sodas that have sugars or have really low acid content. Also, something to be considered is acid reflux GERD. A lot of times when you're at night and you're just bathing your teeth on that really caustic stomach acid, it's going to wear away that enamel layer. So a lot of patients that we see with extensive erosive wear is a result of either acid reflux or dietary habits. The second category of dental wear comes from clenching and grinding, and a lot of times that's manifested at night. So what I mean by that is it's not something you're doing on purpose. Whether it's you're just clenching and grinding because that's the way your body deals with the stress throughout the day, or if you have sleep apnea or some kind of sleep disordered breathing, a lot of times the body uses clenching and grinding as a way to kind of wake the body up. But unfortunately, both types cause a lot of damage and wear to the teeth. So the big thing for that is if we catch it early enough, a lot of times we can protect your teeth with a night guard. A custom-made night guard will protect the teeth, give the bottom teeth something to glide against without damaging them, but also will protect the top teeth and keep everything supported and in line. Unfortunately, a lot of times when patients come to see us, they've had a lifetime of wear and destruction on the teeth. It reaches the point where your bite isn't at the same level that it used to be. So when you're 18 and you bit together, your teeth were here, and over time they've worn and collapsed. And so not only do you see a kind of a mid-face collapse on the patient, but it looks like you can't see your teeth. It looks like you don't have teeth. It looks like a dark hole because there's not enough healthy tooth structure. And unfortunately, the solution for that is a lot more involved. There are a lot of times where that wear is not just a single side or a single area, it's actually all the teeth in the mouth. And unfortunately, you can't just address the smiling teeth or one or two teeth that you see in your visible smile, because if you don't replace and fix the situation with the foundation, any work that we do on the front teeth is just going to get beat up and it's going to get worn down. So a situation like that, unfortunately, is more involved. That's generally when we're looking at a case like a full mouth reconstruction, where we have to really spend time to sit down and protect every surface of the tooth. And we do a lot of full mouth reconstructions here. It's a very rewarding experience because I'm able to give people back the smile, restore their bite to the level it was supposed to be, and also give them a nice aesthetic, functional smile. If you're concerned about dental wear and how it might affect your teeth, there are a handful of things you can do at home to prevent further progression of the wear or to prevent it in general. A hard bristle toothbrush may feel like you're doing a good job, but you're actually doing a lot of damage, not only to the enamel, but also to the gum tissue in that area. So we highly recommend a soft bristle brush. Another thing you can do at home is night guard. Custom-made night guard in your dental office is going to protect and eliminate the majority of any damage you could possibly cause with those teeth by creating a buffer between the chewing surfaces. So it prevents wear and tear, and it also provides a softer kind of meeting point. In addition, a custom-made night guard is going to allow your muscles to relax at night. We design it so that when you go through those left and right movements, the muscles aren't firing off throughout the night, so we can alleviate a lot of jaw soreness, a lot of tension, headaches, a lot of fatigue and tenderness in the morning. And the final thing you can do to protect your teeth from wear is not use your teeth as a tool for something they're not intended to do. Teeth are designed to cut food, send it to the back, and really grind up and chew that food. When you start using your teeth to break ice, to chew really hard things, to open packages, to bite on a pen or bite on a chopstick, that is not what the teeth are designed for, and unfortunately you're setting those teeth up for failure. If you've reached the point where your teeth have a lot of wear and a lot of damage and you can't mitigate that damage anymore at home, unfortunately that becomes a time where we have to address it dentally in the dental office. And a lot of times that does involve extensive crown and bridge work to really protect those teeth and prevent them from breaking down further. If you're wondering when you need to come see a dentist because of your wear or concern about your wear, some of the telltale signs that you can look for at home are flattened teeth, so flattened cusps. You don't have the normal anatomy and contour that you may have previously had. Divots are kind of indentions or wear facets along the surfaces of the teeth. Generalized sensitivity amongst all the teeth, jaw pain, tenderness in the morning when you wake up, tension, headaches, and it feels like you're just clenching and squeezing all night. These are all kind of telltale signs of dental wear and damage that you're causing the teeth that we need to address. If you're concerned that you might have dental wear or worried about the direction that your teeth are headed, we'd love to have you come in and meet us and let us make a customized plan to take care of your mouth. I'm Dr. Brett Langston. I'm here to help you watch your mouth.
Down in Brookhaven with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on thoughts, the dumbest you've ever seen.